Hi everyone, I'm Kimberly Bottom. This is WCI TV, brought to you by Tower MSA Partners, and I'm joined now by Dr. Mel Pohl. Dr. Pohl, thank you for joining us.
Thanks, great to be here.
Thank you. So our theme this week is opioids, addiction and intervention. So tell me about the process of somebody becoming addicted to opioids.
Well, certainly with a workers' comp case, it's typically an inadvertent process. People go to the doctor, they get a prescription for medication to relieve the pain, they take it as prescribed, and before they know it, it's not working, so they take more. Over the course of time, more isn't working, so the dose goes up, and if they try and stop, they can't stop. And that's the two key components of addiction. The other is that certain people are more vulnerable to the effects of the opioids, and those are the folks that really get into trouble.
Right. So what are the best practices for pain management in some of the older claims when the patient's been taking the opioids for a year or longer?
It really is a challenge, and certainly the first, the reasonable approach to somebody with this kind of situation is to have a conversation. I mean, it depends on the physician or the prescriber, and really it's a conversation around opening the idea that opioids might not be the best solution for this patient. Patients are very resistant to this. They don't want to stop the medication, not because they're addicted, but just because it's the only source of relief that they have. So, working with a patient where he or she is and really trying to bring them along to understand that we may not be in the best situation, and let's have a dialogue about how we might change this.
Right, and then it gets a little bit more complicated when you add in the other medications, right? So can you tell me about some of the challenges of tapering off injured workers who are on other medications as well?
Yes, so the typical combination for somebody on opioids, which are the painkillers, are benzodiazepines, the sedative medications. Can't sleep, I'm anxious all the time, I have muscle spasms, so drugs like Soma or Ambien or Valium or Xanax are often combined with opioids, and each one of those drugs has their own share of tolerance and physical dependence, and each one of those adds to the problem of withdrawal, so that we can really be facing a pretty long process of feeling worse.
Exactly. And then tell me about the other side of things, the physician side of things. How are some best practices to change those prescribing habits?
Another challenge. I mean, these are really challenging problems. Unfortunately, physicians aren't well enough trained to have a conversation with patients. I mean, it seems a little surprising, but the average length of time before a physician interrupts a patient is about 12 seconds. And really the key here is to listen to the patient, understand that there's a reason why they're taking these medications, and there's a reason why they're resistant to giving up the medications. Knowing all of that and being open to having a communication and trying to strategize how to end the process of dependence is really where the physician needs to be.
Right. Well, thank you very much for the inside look at this problem and offering your insights.
Thanks, my pleasure.
Absolutely. This has been WCI TV, brought to you by Tower MSA Partners. I'm Kimberly Bottom, and we'll see you next time.